Welcome and thank you for joining us for today's Healthy Living lecture event on healthy weight and aging, hosted by Henry Ford's Senior Healthy Living Program. My name is Claire Horton. I will be your moderator for today's lecture. I am the practice manager of the Bariatric Surgery and Weight Management Program at Henry Ford West Bloomfield. This morning you will hear from Dr. Suki Singh, a primary care provider and the medical director of weight management at Henry Ford Health. During today's lecture, you will learn about the disease of obesity. Dr. Singh will discuss the causes of weight gain, how to make healthy eating easier, and she will review exercises that can help you maintain weight. Dr. Singh will also provide an overview of treatment options for obesity. After Dr. Singh's presentation, we'll have a question and answer session. So if you have a question during or after the presentation, please type it in the chat box. Please try and avoid sharing any personal medical information. And if you are joining us by telephone today, I'm sorry we are not able to respond to your questions via telephone, but if you have access to email, you may email your question during or after our presentation to healthyliving@hfhs.org. And we can put that in the chat box and we will try to respond to as many of your questions as possible. And to ensure a smoother experience for everyone, if you could please turn off your cameras and please note that your microphones have also been muted. This lecture is being recorded and will be available to watch again at your convenience on the Healthy Living Lecture Series webpage at henryford.com/Healthy Living Lectures. And now I'm pleased to introduce Dr. Suki Singh.
Thank you, Claire. Welcome to today's Healthy Living lecture, and as we discuss healthy weight, aging, and the disease of obesity. So what is the disease of obesity? Obesity was first recognized as a disease in 1948 by World Health Organization. Then in 2013, American Medical Association designated obesity a disease as a result of insufficient willpower, lack of discipline, and bad choices. Now, obesity is defined as a chronic, relapsing, multifactorial neurobehavioral disease. We now understand an increase in body fat promotes adipose tissue dysfunction and inability for one's ability to adhere to a diet plan or exercise. Why is it important to treat the disease of obesity? Obesity itself affects many different organs at many levels. It can cause your primary type 2 diabetes, hypertension, high cholesterol, stroke, increase your risk for heart disease, increased risk of depression, increased risk of mechanical disorders such as osteoarthritis of the hip or knee. And complications can also include kidney failure and cancer. American Institute of Cancer now recommends that after smoking, being at a healthy weight is the number one thing you can do to decrease your risk of developing 13 cancers, including and not limited to esophageal cancer, liver cancer, kidney cancer, breast cancer, colon cancer, and many more.
That's interesting.
So one may ask, why am I gaining weight? Unfortunately, it's not just a diet and exercise phenomena. There are many causes for this. There's many genetic predispositions to the disease of obesity. There can be physiological forces that are working against you. There are behavioral changes that are easy to recommend to a patient, but hard for a patient to adapt to. There's environmental factors that can also contribute to one's ability to lose weight. So as I mentioned earlier, causes of weight gain can be hereditary. There's also environmental factors where we're exposed to ultra-processed foods. Trends are also showing now that there's decrease in physical activity and increase in sedentary time in many individuals' lifestyle. There's increased usage of medications such as psychotropic medications that can also cause metabolic issues, insulin issues, and cause weight gain. Smoking habits can also cause weight gain. Increased age of a mother at first birth is also a risk factor to the disease of obesity. So why does being at a healthy weight matter? If you take a look at the look-ahead trial, greater than 7 to 10% weight loss is associated with improved comorbid conditions like diabetes, decreased cardiovascular events. So eating healthy and increased activity improves insulin sensitivity, endothelial function, reduces inflammation in the body as whole. So it can also affect and decrease and improve your autoimmune diseases. When we're looking for a best diet to try in the market, there's many different diets, many fad diets, many recommended diets by multiple organizations. But remember, the best diet is going to the one that you can follow, the one that you can adhere to for the longest, which can help promote decrease inflammation, decrease myocardial dysfunction, decrease gut stress, as well as increasing the healthy gut microbiome and having impacts at the molecular level, which you may see down the line in improvement in chronic conditions like diabetes, high blood pressure, fatty liver disease. There are certain core behaviors that are recommended for long-term success. And one may ask, why is it important to have these core behaviors? Because these are the ones that are going to predict your ability to keep the weight off that you're currently working on to lose. And some of these are simpler than others. So starting to weigh yourself once a week is an often recommendation I make to my patients in the clinic. And logging it into your phone or you're putting it on your calendar can help you see your progress month to month. Planning your meals before going grocery shopping, eating breakfast every day is important. Keeping certain trigger foods out of your home is an important concept to keep in mind as you're grocery shopping. Wearing an activity tracker is important, and logging that activity into your phone or your calendar can also help you see how much activity you're actually doing on a day-to-day that you may not be accounting for. And then also eating regular meals throughout the day, so small meals throughout the day, and not have the typical adult starvation diet, what we call it, which is skipping meals or eating all day and having a large meal at the end of the day. Your body itself is not able to tolerate or knows what to do with such a large volume of food, especially when your metabolic function is the slowest at the end of the day. Adding physical activity when you can and where you can. It doesn't have to be at the gym. It doesn't have to be an hour together. It could be broken up throughout the day. And de-stress every day, but at the beginning of the day as well as at the end of the day. As we talk about healthy eating behaviors, it is important to keep that in mind at each one of your meals. So we recommend to patients maybe choose a smaller plate, fill half of your plate with vegetables and fruits, and the second half can be a lean protein of your choice with a healthy starch. When you're picking your food options, it's important to recognize we're humans, we're not robots, we're not going to be able to eat chicken every day. So rotating your food options throughout the week is going to be key to be able to adhere to food planning and home planning for these meals. And increasing water intake is important throughout the day. When you're cooking with healthier oils such as olive oil instead of butter is going to be helping reducing the calorie density that's going into your food preparation. Using a method to help measure serving sizes when you're preparing your plate is another concept to keep in mind. When you're looking at picking a protein serving, using the size of your palm to understand that's a half a cup, which is about 3 ounces, can be helpful. And then looking at your fruits and vegetables, I always say those are free choices. That should be half of your plate no matter what. So if you want to do serving sizes, you can, but it really helps kind of help fill in those gaps in the stomach that may want food after you're done eating. Using 1 serving of dressing or jam or mayonnaise, whatever your dressing of choice is. And the key here is going to be your thumb, which is about 2 teaspoons. And when you're looking at oils, whether you're cooking with oils or they're going on your plate, using the tip of your thumb, that's going to be 1 teaspoon. As we prepare to look at our week ahead, it's important to make a list of all of your foods for breakfast, lunch, and dinner, and snacks. So plan ahead. When you go to the grocery shopping, stick to your grocery list. Do an inventory of your pantry as well as your fridge to develop a comprehensive grocery store list so you can make sure when you're planning these meals out, you have all ingredients at home. When you're picking dairy, choosing low-fat or non-fat products is helpful. Choosing hard cheese over soft cheese can also help decrease the fats in these specific foods. If you are buying things like chips, candy with kids at home, I always recommend buying the smallest package. That's a single serving or a 2 serving instead of buying the large family size. Unfortunately, with those, sometimes we may go 2 to 3 servings without even knowing. I've provided a link here that can take you to developing a comprehensive grocery store list. It's a printable list. If you click on the link, you should be able to get to that. So as you plan your grocery shopping, plan for the whole week ahead, list for foods that are going to be sorry about that. List of foods. It's going to be important to remember as you're planning your meals. So in each group, you have to think about what's going to be my protein option for my 7 days at home or 6 days at home for lunch, dinner, and breakfast. What's going to be my whole grain option, my starch option, and my fruits and vegetable options. What's going to be consisting of my dairy that I should have as part of my day-to-day routine, and then some healthy snacks that you may turn to if feeling hungry in between meals. Buying vegetables that are frozen is also convenient and requires less prep and increases shelf life, but you want to make sure you're buying vegetables and fruits that don't have any added salt to them. So typical a grocery store, you may find fresh fruit, you may find canned fruit. Typically, we'll recommend buying fresh fruit is going to be your best option. If you are choosing juices, sticking with 100% juice with no added sugar is going to be an important factor to keep in mind. Read your labels before purchasing. Choosing a variety of vegetables throughout the day to keep you consistent and making it convenient as part of your plate is going to be helpful. Picking dark green or colored vegetables that are going to be rich in nutrients is always also helpful for the gut microbiome. Eating 2 servings of fruit daily as a snack option is a key. Adding at least 3 to 5 servings of vegetables throughout the day as part of your meal, but also as a snacking option is also helpful. So as we think about fruits and vegetables, we have to think about why eat such products. And remember, it has more to do with your gut microbiome. It promotes a healthy gut bacteria, which has to do with digestion, your bowel health, helps improve and control your blood sugars, lowers cholesterol levels, lowers blood pressure, as well as inflammation. And for chronic weight management, for staying full longer, we always recommend to patients that eat as many vegetables as you can, the non-starchy ones. So these are going to be the key things to keep in mind as you think about chronic weight management for the good, healthy gut bacteria. Protein-rich foods, again, you want to choose lean meat options and rotate your meats throughout the day to help meal planning, making it easier. You can buy it frozen or fresh, but again, you want to read labels while you're buying frozen to make sure you're buying products that don't have much added salt to them. So on a Monday, you may decide to do fish with a cup of vegetables and a cup of starch. Tuesday, maybe chicken, and then Wednesday, maybe turkey. Thursday, maybe your plant-based diet day, and that could include a bean or a lentil dish. But then the next week, you could rotate some of these dishes again to make meal planning easy. Also, bulk cooking can be helpful when you're doing some of the bean dishes and lentil dishes. Why is it important to eat such foods throughout the day? Why is it important to eat fruits and vegetables throughout the day? It has to do with the anatomy of the body. It has to do with the pathophysiology of the body. Remember, 500 calories can either come from a bag of crackers, such as 24 Triscuits, or 500 calories can easily come from 4 tablespoons of olive oil or another oil, or you can use fruits and vegetables to fulfill the 500 calories, and it has a lot to do with your stomach size and the hormones that are released by your stomach. Once your body is able to feel that fulfill feeling when you're eating, it's going to decrease or stop sending in the signals from your ghrelin hormone, which responds back to your brain to say stop eating. So eat slow, eat strategically for each meal. Some of the 100-calorie snack options to keep in mind while you're grocery shopping, it could be purchasing bananas that require no prep, or low-fat popcorn. Looking at dates is another option. Cup of grapes, cup of cottage cheese, half an avocado, or crunchy chickpeas. But again, this is where it's going to be important to do label reading if you're buying pre-made foods. Increasing water intake is going to be important during your meals and also after your meals, as well as in between your meals. You can hydrate from your foods that you're consuming. Those are your fruits and vegetables, or broth-based soups, or melons. You can add fresh fruit to flavor your water. That could include adding orange, cucumber, pineapple, whatever you choose to do. Adding Crystal Light to your water can also be helpful. And then once we decide that, according to your clinician, if they recommend 60 to 70 ounces water every day, buying some flavored waters might be helpful. There are some lower calorie carbonated options that can take over your daily soda intake, or at least substitute for that. And when you are drinking water, the key is to take advantage of the moment and take 10 sips each time. Set timers to drink water throughout the day if you have a busy work schedule. And if you have a timer set up every 2 to 3 hours on your phone, you could drink 1 bottle at a time, or 8 ounces at a time. And then eliminating or at least decreasing caffeine usage can also help, because remember, that also increases urine production, causes fluid loss, which can also put you in the negatives with the water intake. So that needs to be replenished as well throughout the day. And making water more convenient for drinking throughout the day, use a pre-filled water bottle. As I talked about earlier, de-stressing is really important, and it should be part of your chronic weight management strategy here. And this could include a 5-minute meditation session before you start your day or at the end of the day. It could include a brisk walk inside your home or outside your home when the weather permits. Prioritizing a good night's sleep is really helpful. We usually recommend to patients that you should put away all electronics and limit any blue light usage at least 1 hour prior to going to bed. And social media is an important one to keep in mind as we are using our phones right before bedtime. You want to follow more positive pages, positive people that will give you more of a positive outlook throughout your own life. So how do we improve our gut health? Again, eat a variety of fruits and vegetables. A study actually showed patients that ate 30 different types of plants each week had a better gut bacteria than who ate 10 or fewer. Water is really important to improving the gut microbiome, as well as the regular bowel movements, helps flush out toxins and waste out of the body. When you are eating, it is important to chew well, which helps stimulate the production of digestive enzymes, makes it an easy, powerful tool for better digestion and also weight loss. Eat at a slower pace, be mindful and enjoy your food. Regular exercise also helps release certain hormones in the gut that can help promote with digestion, as it also improves with blood flow to your gut. Fiber foods also help, again, feed the good gut bacteria, which we want to keep happy. As we're thinking about food at the grocery store, we want to think about, you can have sort of my regular day-to-day food, your good foods, or some are almost we want to call bad foods because they induce inflammation, and those foods are refined sugars, vegetable oil, your fast foods, processed meats, and all, in many cases, some of the fried foods as well. So if you're thinking about snacks, you're looking for something crunchy, you could switch from chips to some of the carrots or another crunchy vegetable and pair it with hummus. If you're thinking about something sugary, switch to fresh fruit. When you're buying other snack options, making sure you have some non-salted nuts at home, and having a serving of that as a snack option is a good choice. And also swapping your butter to olive oil is a great substitute to decreasing that fat throughout your diet. As we go from our home and the grocery store to being out in public. If you're ordering a drink, perhaps from a medium cafe latte with whole milk, you may switch to a small cafe latte with fat-free milk. You may switch from a regular soda to maybe a carbonated water instead, or going from a sweetened tea to an unsweetened tea, or maybe add lemon and ice to your water, which is important when you're at a restaurant to keep in mind. Dining out is part of our day-to-day, and it is important to plan that piece out as well. And creating a healthy plate method, even when you're dining out, is really important for that chronic weight management. One thing I always tell patients is don't skip your meals throughout the day just because you're dining out tonight. You should eat consistently as you would throughout the day. Look at the menu before you go to the restaurant and prepare to know what you're going to be ordering on time. Choose a baked option instead of a fried or a breaded option can also decrease the calorie content of that food. Ask for no bread or chip baskets. Instead, ask for water, flavored water, add lemon or ice upon arrival. And if they do have bread options, you can ask for whole grain and split your meals with a partner or take half to go from the get-go. While you're eating, it's important to do mindful eating when we're at a restaurant, so that may include putting your utensil down in between each bite and enjoying your company and the conversation of the person you're with, and chew, eat, bite thoroughly. And again, pace yourself and be present in the company as well as the food you're enjoying. The next concept we're going to talk about and emphasize on is exercise. Often I hear is exercise is so hard to do, it's so hard to put it into my day-to-day because of my busy schedule. Often it has to do with having high expectations for one, or forgetting to acknowledge the constraints of your daily schedule, or expecting that exercise can only happen in the gym. What you want to do is create some sort of a flexibility in your day so you can incorporate exercise where you can and when you can. What we're seeing is a trend that over time, since between the years of 1965 to now, there's a significant decrease in daily physical activity for many individuals, and there's increase in sedentary time, which is expected to go up to 42 hours per week by 2030. And that's a significant number to keep in mind. 42 hours. Even if we take out 5-6 hours out of that, it could be incorporated throughout the week into exercise or some sort of activity. And so what are the benefits of different types of activities? Because you don't always have to go to the gym and you don't always have to do aerobic or strength training, but there are benefits to combining exercise throughout the day or throughout the week. So strength training can help build muscle, stimulate bone growth, improve balance, controls your weight chronically, and lowers blood sugar. And this can be weight training with kettlebells or dumbbells that you may decide to keep at home, squats, resistance band training, body weight training, and you could do this 2 to 3 times a day. 2 to 3 times per week, or you can do a combination of those in a day before you start your day for 10 minutes in the morning, do it through rotation. And then aerobic activity can also improve heart health, improve your mood, lower your blood sugar and blood pressure. And again, it could be a combination of these, or it could be just one activity that you may decide to do. It could be cycling, brisk walking, jogging, or working in the yard with raking or digging or mowing. Flexibility exercise is really important, especially with aging. It helps increase range of motion, enhances flexibility, reduces risks of injury, strengthens your tendons and muscles. It helps decrease aches and pains in the body. And again, this could be combined 3 to 4 times per week, or it could be once a day for 5 minutes in the morning, some calf stretches, yoga, Pilates, upper and shoulder stretches. Balance exercises can help core and body strength. They also enhance balance, which is important to keep in mind as we're aging, and help decrease falls. And this could include, again, yoga, Pilates, Tai Chi, standing on one foot, or heel-to-toe walk. So how do we make exercise easy so it's convenient and it's not a chore? Walking 10 minutes after each meal or after each snack can help add up. Trying a 10-minute workout in between your tasks can be helpful. Adapt a simple yoga move in the morning, and it could be a 2 to 5 minute routine that'll help your body stretch, wake up the muscles, and get started with the day. And it can also help de-stress as well. And adopting some chair exercises could be simple 2 to 3 chair exercises that you may decide to repeat, especially if you have a desk job or if you're watching television, dancing while you're cooking, if you have a stand-up desk, if your work permits if you have a sit-down job, requesting a stand-up desk can be helpful. From your employer. Working from home, again, get a walking in when you can, get a walking pad for yourself in between meetings or in between your tasks that you're doing. Put a timer on your phone so you have 5 minutes where you can get up and just step away and go for a brisk walk in the house or in your office. So how do you get started with exercise? What's important is to start with an activity that you may like and the one that you can do. You could do the same activity 5 to 10 minutes every day, and before you know it, you would have added 70 minutes of activity already by just adding 5 to 10 minutes daily throughout the week. Plan to stand and stretch in the morning in between your meetings. Whatever stretch you're doing, hold it for 15 to 30 seconds. Walk with a friend during your lunch hour. Helps create accountability. Walk for 10 minutes around your office in the morning and afternoon. That adds another 20 minutes of walking in. And again, try to do some resistance training if you can while you're on your desk, whether it's using a water bottle or small dumbbells on your desk. Or you could join a walking program with a friend to help create accountability. We do offer free yoga class at our Henry Ford Health Weight Management Clinic, and I have listed the phone number here for those of you who might be interested, and you can also email kristenfrick@hfhs.org. One of the things to keep in mind is you want to keep track of your exercise to track your progress. Writing on a calendar or on your phone or an app is going to help you track and see how much progress you've made over the weeks. Using a friend to help you to get reminded that, hey, did you do your 10 minutes of stretching today can also be helpful. But plan to do 250 minutes of activity per week to prevent weight gain. You could do 10 minutes per day 5 times a week, or you can do 15 minutes at once, whatever your schedule permits. It all doesn't have to be at the gym. It doesn't have to be all together in an hour. So at Henry Ford, our primary goal is to treat the disease of obesity for the complex disease it is. And it's what we do with our patients is it's a multimodality treatment. When patients are coming to our clinic, they may be utilizing medications for weight loss in addition to while working with bariatric surgery and seeing the dietitian and working on some lifestyle changes. It is really unique in a sense that every treatment is individualized to the patient that's coming in. So if we have a patient coming in with class 2 obesity, with type 2 diabetes, where their BMI is around 38, they may require multimodality treatment, or we may have a patient who's a newly diagnosed hypertension patient, high blood pressure, and needs to lose 10% of their body weight. We may decide to have them go through the weight management program where they're learning lifestyle interventions necessary for chronic weight management. We have the surgical treatment options as well as the non-surgical treatment options. And in the non-surgical or surgical treatment options, all patients are meeting with a dietitian. They're meeting with an exercise physiologist who are able to assess a patient's ability to exercise and what their limitations are and tailor the program to them. And we also utilize anti-obesity medications, which are typically started by the obesity medicine physician in the office. Visits can be covered by insurance, and if you are not sure, you can always call and we can help check that for you. Typically, when a visit is with a physician or a bariatric surgeon, those are part of your specialty visits that are covered by insurances. We have 5 weight loss clinics that include Detroit, Livonia, West Bloomfield, Wyandotte, and Macomb, and then also with bariatric surgery. We have 5 locations. Instead of Livonia, it's actually at Jackson. And how do we get referred to our program? You can ask for a referral to weight management. You can ask for a referral to obesity medicine. You can ask for a referral to bariatric surgeon, and you will be able to see what you're able to do when you work with the program. And as you progress in the program, we're able to assess and see, are you meeting your goals? If not, we're able to help tailor the treatment option to your needs. And for the non-surgical program, it's a 6-month comprehensive program that focuses really on 5 core behaviors here, and that's nutrition, behavioral wellness, environment, physical activity, and accountability. You may decide to do a very low-calorie diet plan that includes prescription foods up to 12 weeks, and then transition off to a partial meal replacement where now you're using more grocery store foods. So we're substituting foods out from prescription foods to now equivalent grocery store foods. And all programs are led by a dietitian and our health coaches, or you're also attending weekly group classes where you're learning very specific topics on how to cook with lower calories, how to stay motivated, how to increase activity, and you are using an app that also helps create accountability called Verytastic. These are the 24 specific topics that are reviewed during our weekly group classes with patients. So as you can see, the focus is the 5 lifestyle interventions that are necessary to keep the weight loss going and for that chronic weight management. So as you're making that plan for the rest of your year for yourself for the chronic weight management, this is something to consider because we, again, go over label reading, and it's an hour topic of itself, portion control, calorie density, snacking, stress management, sleeping, exercise, flexibility. These are the 5 locations and the phone numbers provided for the non-surgical weight management clinics and obesity medicine clinics. And for specifically obesity medicine, the primary focus here is to make sure that while we're using anti-obesity medications, patients are also seeing the dietitian and the exercise physiologist so that they're able to adhere to a healthy diet and exercise routine while they're utilizing medications that can help with weight management. Visits with obesity medicine and weight management can be in person. They can also be virtually. And again, you have access to a dietitian, you have access to a health coach, a physician, and our surgeons. 6 different medications have now been approved for anti-obesity medications while we're on the topic. Phentermine is one of the older drugs that can help decrease appetite and increase metabolism. Contrave includes Wellbutrin and naltrexone, also helps with decreased cravings for specific foods. Chysemia, which includes lower dose of phentermine with topiramate, also helps with decreased cravings for foods, increased metabolism. GLP-1, semaglutide, which is Wegovy, and Saxenda are the newer agents that are not approved as a once-a-week injection, and the maximum weight loss that's expected with Wegovy is around 16% when a patient combines it with the healthy diet and exercise. And then the newer agent that was approved in November of 2023 for weight loss is Zepbound, which is a GLP-1, GIP-1 combined therapy, and contains the molecule tirzepatide. Once-a-week injection has an expected weight loss of 20.9% in non-diabetic patients. So how do we get referred to Henry Ford Healthy Weight Management Programs? You can get a referral, again, to weight management, our bariatric surgery, obesity medicine, and we will help tailor the diet plan for you. And that concludes the presentation. Thank you.
Thank you, Dr. Singh. That was a lot of really good information. So now we are going to do our question and answer session. We did get some questions in the chat box during the presentation, so we will start with those. And then again, just a reminder, if you did call in, you can email your question to healthyliving@hfhs.org, and I did type that in the chat box if you wanted to ask your question there. So the first question we got, is frozen fruit with no sugar a good choice for smoothies with almond milk and protein powder?
Yes, that's going to be a good substitute of any other frozen smoothie that you can get outside at the store. So if it's homemade, that's already better. Two, you're looking for key ingredients, no added salt, sugar, and adding protein powder to your smoothie, again, makes it one step better.
And then the next question, how much protein, carb, and fat should someone eat to lose weight?
It's variable from patient to patient depending on their BMI, but also based on their comorbidities that they may be dealing with. So typically, if it's a kidney disease patient, it's a lower protein diet. If it's a patient who is healthy individual just trying to lose weight, if you're exercising, doing strength training, you're going to need more protein. But in general, as a blanket statement, I always say if you're healthy, you don't have any kidney disease, add 20, 30 grams of protein at each meal.
And the next question, can one use avocado oil for high heat cooking?
Yes.
Okay. And next question, if I lose enough weight with the medications, can I stop taking them?
That is the hope, that as you take any of these anti-obesity medications that are becoming more readily available and being utilized, the hope is that you're also learning the right eating habits and right exercise routines that are going to help maintain that weight loss. So specifically with the GLP-1s on TikTok, they're known as the skinny shots, that's Wegovy or your Ozempic. Remember, there is more lean mass loss that's associated with that specific class of medication when compared to Zepbound or Mounjaro, which helps maintain some of that lean mass, but also focuses more on fat loss. So as you're working with your clinician who's providing you the medication, make sure you have a strategic exercise plan in place and eating habits in place, that you're still eating sufficient protein to maintain that good healthy mass, muscle mass, to maintain that weight when you come off of the medication.
Next question, what are your thoughts on intermittent fasting?
Good question. Intermittent fasting can be quite effective for many individuals if they're snackers. But one thing I personally don't like about intermittent fasting is many individuals will skip that breakfast and continue to eat until 8 p.m. And strategically speaking, what you want to do is keep your intermittent fasting window around about 10 hours, where you can implement a healthy breakfast in the morning, lighter lunch, and a lighter dinner, and use that intermittent fasting to avoid the night eating that's causing that additional weight gain or that additional calorie intake as part of the chronic weight loss struggle.
And does one serving of vegetables equal 1 cup?
Yes.
And what are your thoughts on the Mediterranean diet?
Very effective diet. Mediterranean diet itself is, again, includes all the healthy oils, fruits and vegetables as a whole, lean meats, and if you're trying to change a lifestyle, if you can implement some of those behaviors as part of your day-to-day, it can help with chronic weight management.
And what are the most concerning side effects of using the weight loss medications?
One of the more concerning side effects that one should be worried about as they're using this for long term, like I mentioned earlier, is the lean mass loss. And when patients are not eating, because these medications suppress the appetite and decrease the contractility of the medicine, especially the injectables, they may not be eating sufficient protein. And that can further slow down your metabolism. As you lose more muscle mass, there can be more weight regain after you come off of the medication.
Okay. And the next question, if I have to lose 115 pounds or so, what is my best option?
I would start with getting a referral to one of our programs, and the provider can sit down with you, whether it's a nurse practitioner or a physician, and look at your BMI, look at your comorbidities, and develop a comprehensive plan for you, whether that includes working with a dietitian, using some medications in conjunction with bariatric surgery, which is now mainstream to think metabolic surgery if you're struggling with diseases like type 2 diabetes, high blood pressure, liver disease, and kidney disease.
And are smoothies with fruit or fruit juice higher in calories than eating the fresh fruit whole?
It depends on how the smoothie is prepared. So if you're using fruit juice, remember that's essentially fructose, and that's going to have a different impact on your body with insulin levels. So instead of using fruit juice, if you could pick it an almond milk or a skim milk, that would be a better option to reduce that calorie content of the smoothie. Whole fruit, that's equivalent, and add a protein powder to help make it more balanced. So the answer is yes.
What are your suggestions for someone who has a small appetite and is skipping meals?
Again, that's a lifestyle that may need to be looked at by a dietitian or a clinician who can see what is the cause of your light appetite. Is it related to a slower metabolism now because chronically you may have skipped meals, and or is it a busy lifestyle? So that can be strategically changed with the help of an expert.
Is sucralose a healthy sugar substitute?
Another great question. We're noticing more and more of these sugar substitutes causing internal changes with the insulin pathways. So unless it's a plant-driven sugar, I usually recommend against those.
And do you have a preference for milk alternatives, oat, soy, or almond?
They're all great choices. Almond is a great way to go about, and so is oat milk.
If a person has already had the gastric sleeve procedure, is it safe to have it done again 10 years since the first procedure?
Typically with the gastric sleeve, they can't revise the sleeve, but if you're having symptoms like acid reflux, you're noticing larger volumes of foods going in, now you're developing things like type 2 diabetes, it might be worthwhile to get a consult with one of our surgeons or obesity medicine doctors to talk about treatment options for you, because that may require either medications or revision surgery based on your clinical criteria, but typically they won't repeat a gastric sleeve again.
We're getting a couple more questions about sugar substitutes. So what is a good sugar substitute?
Monk fruit is a good substitute. Natural honey is something else that can be used as part of your morning coffee. Again, any plant-derived sugars are going to be a good substitute than any other artificial sweeteners.
It looks like there's a study out recently that states Crystal Light has an additive that causes cancer. What other recommendations do you have for a water additive?
I'm not aware of that study as of yet. I will look into it. Other additives, because remember we're adding Crystal Light to flavor the water, so I always say go for a natural route. So if you're making a bottle in the morning, put some natural fruit in there, or add lemon to help with the metabolism. So there's so many other options that are more natural, plant-based, rather than the artificial things that are on the market. They're always going to be a better, healthier alternative for you.
And what is a protein powder that you recommend?
Again, many different options on the market. Orgain is a personal favorite of mine. Premier Protein also has some. Fairlife makes a good protein shake. And then at our weight loss clinics, we also have some meal replacement protein shakes that can be added to your day-to-day protein shakes.
And just one more question, for someone who hasn't started making any lifestyle exercise changes, where do you recommend starting?
Start today. Start by looking at your day and see where you can add a 5-minute brisk walking. You can add a 2-minute stretch. If the weather is nice today, you can go for a 5-10 minute walk. And before you know it, you're already going to be adding another 15-20 minutes of activity. And then if kind of looking at your schedule on a day-to-day, knowing that if your day starts at 7 in the morning and it doesn't stop until 6 p.m., where do you have a break where you may be able to add in 5-10 minutes of activity while you're at work, because you go up and down the stairs, while you're on your desk job, doing some chair exercises, and or maybe just do a walk around the office. So start today, it's never too late.
Great. So I think I don't have any more questions in the chat box, and there were none in the email. So this brings us to the end of our event. As a reminder, this lecture has been recorded and will be available to watch again to share with friends and family members. In the next couple of weeks, visit henryford.com/healthylivinglectures to view Dr. Singh's presentation. If you would like to schedule an appointment with weight management at Henry Ford, please call us at 866-326-6790. Again, that number to schedule an appointment is 866-326-6790, or you can visit us at our website, henryford.com/weight management. This information should be placed in the chat box as well. If you're not a member of Henry Ford's Senior Healthy Living Program, please sign up for this free program, which is open to anyone age 55 and older. And to enroll in the program, go to henryford.com/healthyliving or call 313-874-5455. As a member of the Healthy Living Program, you will receive the Healthy Living newsletter, which is published 3 times per year, the annual health and wellness calendar, and invitations to the Healthy Living lecture series and other benefits. Before we conclude for this afternoon, I would like to announce that the next Healthy Living lecture event will feature a discussion on heart valve disease and will take place on Tuesday, April 2nd from 2 to 3 p.m. And we hope you all can join us again then. So keep an eye out for in your email for an invitation to the April 2nd lecture event. And you can visit us at henryford.com Healthy Living Lectures for more information and to register. And on behalf of myself and Dr. Singh and the Healthy Living Program, thank you so much for joining us.